Hi, everyone, and welcome to the SRHM podcast. My name is Nina Sun, and I'm an associate editor for the SRHM Journal. In this episode, we hear from the authors of the paper, Setting Research Priorities for Prevention and Response to Child Marriage in Communities in the Arab Region. Findings from a multi-stage Delphi study involving practitioners across the region. This paper was published in the 2023 open issue of the SRHM Journal. We speak to Janna Metzler, co-founder and executive director of the Agency Project, a new nonprofit dedicated to improving population health through community-driven solutions, Aisha Hutchinson, senior lecturer in social sciences at the School of Education, Communication and Society at King's College London, and Katrina, a postgraduate researcher at the School of Education, Communication and Society at King's College London. Welcome, everyone, and thank you so much for joining us today for this podcast. I'm going to start by asking you about the rationale behind this paper. Can you speak a little bit to the gap in knowledge that this article speaks to? Why was it important to publish on this topic?
Thank you for a great opening question. Essentially, we felt it was important to publish on this topic to ensure regional distinctiveness is not lost in current global attempts to develop a child marriage research agenda. So various studies, particularly the work which has been done by Margaret Green and colleagues, have documented the exponential growth in child marriage-related research over the past decade. We have seen global coordination facilitated by the World Health Organization and others to examine the nature of the current research being published, to identify research priorities for the future. The Child Marriage Research to Action Network, the CRANC, is another good example of a platform for coordinating the global research agenda on child marriage, and it also encourages the uptake of research by policymakers and practitioners. And while this work at a global level is obviously important, particularly for guiding large-scale work like the UNFPA UNICEF Joint Global Programme to End Child Marriage, we were concerned that if this kind of work only remained at the global level, then regional priorities and regional distinctiveness might be missed, particularly when it comes to the Middle East and North African region, which is often shortened to MENA. And there are a few reasons why we felt that the research needs and priorities of the MENA region might be a little different. So research has shown us that rates of child marriage in the MENA region have historically been below the global average, as opposed to other regions like Sub-Saharan Africa or Southeast Asia. So it hasn't been considered a child marriage hotspot, so to speak. But research data also tells us that this progress has stalled and that this is largely fueled by social, political and conflict-related crises and natural disasters that are prevalent in the region, including large waves of forced migration. And this means that the prevalence and the nature of child marriage can vary enormously across different communities, even within the same country. The MENA region also has not typically attracted high levels of child marriage research like other regions, but significant research attention has been given to child marriage amongst Syrian refugees over the last 10 years. And this has led to some concerns that research on child marriage in the region is very narrowly focused on certain populations and on certain aspects, such as the drivers and the prevalence of child marriage in humanitarian contexts, leaving significant gaps. And there's also been a lot of attention to minimum age marriage laws across the region in recent years, resulting in a lot of activism, social change, and in some places significant controversy. Concerns over child marriage are sometimes framed as international or Western interference, making it quite sensitive work at times, including for researchers. So this study was derived out of ongoing discussions with and strong participation from the Regional Action Forum to End Child Marriage. And this forum is funded through the UNFPA and the UNICEF Global Programme, partly to ensure learning from the global programme is shared in the MENA region, but also the forum acts as a regional coordinator and exchange mechanism between different partners, such as UN organisations, INGOs, NGOs, and civil society organisations. And this happens through webinars, resource sharing, convenings, for example. And one pillar of this work does focus on research coordination and research dissemination. So the aim of our study was to provide really concrete recommendations to practitioners, academics, and policymakers on setting priorities for research in the MENA region, which takes into account the nature and the history of the region, particularly recognising that many communities were and continue to be affected by humanitarian crises.
Thank you so much, Aisha. This paper also has a very unique research methodology. Could you tell us why you chose this methodology and what were the advantages and disadvantages of using it? I'll turn to you now, Janna.
Such a good question. The Delphi technique has been around for now close to 75 years and used widely by health and social science researchers to support a systematic process of reflection by professionals, of experts in their respective disciplines. More recently, we've seen the rise of consensus methodologies such as this in distilling key reflections and learnings from humanitarian practitioners. So for those of you unfamiliar with the methodology, the Delphi technique gathers data through a series of questionnaires. It's a structured process to reach consensus on a given topic. And in this study specifically, the technique allowed for us to cast a wide net through the use of online surveys, looking at gaps in evidence, capacities required to undertake and use research, and elements within the research uptake pathway that are vital to progress. So there were a few reasons as to why this methodology was a good fit. For one, the anticipated participant pool covered quite an extensive array of countries in the region, and those working within different types of organizations across these countries to respond to child marriage. We were able to overcome barriers associated with transportation or visa restrictions to and from larger learning events, overcome pandemic-era restrictions on other in-person methodologies, and also the costs associated with participant time and engaging in the research process. I think one of the disadvantages of this approach is that the iterative nature of the approach can lead to reduced participation over time with the multiple subsequent rounds of questionnaires. But another example or another advantage of this technique is that unlike traditional in-person focus groups, for example, the Delphi technique allows for participants to share their views anonymously, which may encourage transparent or more nuanced responses, whilst mitigating potentially dominant views that may be in the room or biased in relation to those hierarchies we may find in society or within organizations. So we found this appealing as a way to elevate the voices of those community-based actors so critical and often undervalued in prevention and response efforts.
Thank you, Janna. Now on to the next question, which is, working on this paper together, could you tell me what were any specific findings that stood out to you personally? I'll first turn to Aisha and then to Katrina.
Thank you. Yes, for me, while our findings show that child marriage research is valued by practitioners and policymakers in the MENA region, and also that there is a good degree of research literacy and capacity in many organisations. So many organisations who participated in the study have been involved in research, understand the research process, have partnered with researchers and want to use research to inform policy and practice development. Yet, almost half of respondents said that they face difficulties actually using and incorporating child marriage research in their day-to-day work, with most of these saying that they find it difficult to translate research findings into concrete actions, policy, and programming. So what stands out to me is the what next aspect of research, the uptake, the use of research that is produced to inform action, often to answer the how questions. And for me, it raises questions about how we invest in these processes and the mechanisms so that policymakers and practitioners are actually able to use the research to inform action. And when thinking of the what next and what do we do with the research we have, I think that this will require much better and more meaningful collaborations between researchers and practitioners. I think it will require more time and also a drive to use more community-based and community-engaged research methods, which we asked a little bit about within our study. It's also important that money is already set aside at the beginning to ensure that findings are able to be used to concretely inform actions that ultimately make a positive difference in the lives of adolescent girls and their families. It was really clear from the findings that our participants essentially want research that helps them do their jobs better. And it's not always available in a form that they can easily use to do this at the moment.
Thank you, Aisha. Yes, the element of knowledge to action is incredibly important. Katrina, what stood out to you personally during this study?
Thank you so much, Aisha. I'd love to come in just briefly on your last point about our participants wanting research that helps them do their jobs and is accessible. I think this is extremely important, and it may be slightly obvious, but when thinking about research design at the start and sharing of findings at a later stage, this should also include considerations of how research outputs might be used throughout the entire research process and not just at the end. Our participants felt that easy to read and shorter research outputs were most helpful for them to develop evidence-based programs and policies and advocacy efforts. And I'm thinking about this podcast that we've joined right now and how this kind of format, it really does support accessibility and sharing of knowledge in a way that may reach people who might not have the bandwidth to read long reports or even access to articles online. Something like this podcast, or even case studies, are so beneficial in bringing to life research findings that may be crucially and immediately needed by practitioners and other colleagues working in this field. Something else I'd like to reflect on is time in research. We know research takes time, and while it's being undertaken, the world is moving forward and other research is underway, meaning that the building of a particular field of research is not linear. And I'm going to take an example here, drawing on the findings that really stood out to me. At the time we did the study together, 95% of practitioners agreed they would like to understand how to support girls with disabilities who are at risk of experiencing child marriage and the consequences of marriage. Our participants highlighted this as a key knowledge gap for them. And I think there's recognition in this that girls are not a homogeneous group, and therefore addressing child marriage needs to be informed by evidence that is grounded in the experience of many different girls. The region where our participants work also faces various humanitarian crises, which can often create or exacerbate experiences of disability. And this might also explain their high level of agreement on this specific research gap. But I think there's still more to learn about why our participants prioritize this gap in the region, and also how it should be addressed. Overall, I think we need more evidence in this area, not only in the MENA region, but also globally as well. There is not enough of a comprehensive and context-specific understanding on the specific risks that girls with disabilities face, and also what their needs are in relation to child marriage, and whether they are falling through the cracks in initiatives to respond to and end this practice. Personally, for me, our findings are linked to my current doctoral study, which is dedicated to addressing this evidence gap in Zimbabwe in partnership with Rosaria Memorial Trust and the Women's Refugee Commission. I mentioned the element of time and research a bit earlier, and since we did the study, a bit of time has passed, and there seems to be increasing awareness and efforts in understanding and addressing this particular aspect of child marriage. And I think we're really seeing this now on a larger scale, particularly within the third phase of the UNFPA and UNICEF global program that was mentioned earlier, which has adopted a stronger intersectional and disability inclusive lens. And since publishing our research in sexual and reproductive health matters, the Regional Action Forum completed a desk review of evidence on the impact of child marriage on children with disabilities in the MENA region. It's interesting to observe how attention to this area has grown, and it's clearly still growing. And it's also interesting to note what are the specific drivers for this growth. The recent desk review offers some key recommendations, but I think it also still highlights a lack of regional and global evidence on child marriage and disability. It's really encouraging to see efforts to spotlight and address this gap, and our study findings very much complement and support development of a regional research agenda to do so. But more work needs to be done on how a research agenda that prioritizes child marriage and disability should be created and implemented within the region. And I really hope that if this agenda is ever created, it keeps accessibility, inclusivity, and community-driven approaches at its heart.
Thanks so much, Katrina. Yes, these are all the values that SRHM holds as well. So on to the next question, and Aisha mentioned this. Where do we go from here? What are the next steps now that we have all this evidence?
In terms of next steps, as you've said, we've already talked about this in the podcast already and in the paper as well, particularly about the role of our research in developing a research agenda for the region, which can be used by the Regional Action Forum and others, of course, to determine what research to invest in and pursue. And it's been really encouraging, as we've already heard from Katrina, that the Regional Action Forum have already commissioned a review of the literature on child marriage and disability to highlight key learnings for the region and also highlight more in depth what further research is needed. We've also already talked about the importance of investing in the processes and the mechanisms which ensure research can be used by actors in the region to inform policy and programming. And this is also something that the Regional Action Forum wants to take forward. And we've also talked a little bit across this podcast about the importance of regional distinctiveness and how this impacts perceptions around what research is needed and what research is useful. And I think next steps here would be to further unpack some of our more surprising findings that we haven't had a chance to talk about, but which really, particularly in the light of the current social, political, and economic and cultural processes that powerfully interact the ways in which we address child marriage and which we are seeing very much in the region at the moment. Janna, would you like to add to this?
Thanks, Aisha. As you noted, there are elements here that require further unpacking. In the article, we highlight a number of opportunities to advance evidence generation to strengthen child marriage prevention and response strategies for adolescent girls and their family. We highlight the need for locally developed and responsive evidence that can inform policy debates in real time within each country, and also as part of a coordinated regional, this common voice. Right. So to me, the next steps include a participatory process, this concerted effort to bring together a more diverse group of academics and practitioners. And this group would be inclusive of young people and grassroots activists to determine how best to address these gaps in evidence, right? How to address gaps in capacities to conduct and to use the evidence. And then how to flesh out the details of a process of engagement that then provides this platform to work together collaboratively. And there is precedent for this type of process-oriented approach. There's been similar efforts in different regions that we've been a part of that have emulated a similar participatory approach where, for example, in Eastern Africa, working with Rosario Memorial Trust, we worked with over 80 feminist grassroots organizations, all coming together to develop a roadmap that was responsive to both national and regional priorities, and also able to move in real time to inform law and policy debates. So I think there's a lot that can and should be done in relation to providing a strong evidence base on child marriage that directly connects to improvements in legislation and programming for adolescent girls, their families, and communities. But again, it's not a one-size-fits-all solution. It is something that needs to be process-focused and participatory in nature that grounds the design and its uses in communities most affected.
Thanks, Janna. And I would say that our research indicates that there is momentum and a strong desire and also capacity for a shared and inclusive vision to be built that is locally led. And without saying this lightly, with conflict in the MENA region escalating on what can sometimes seem like a daily basis, which we know increases child marriage, there is a responsibility to work together and share and use the knowledge and the experience that we have in the region to protect this and the next generation of girls from child marriage. And to me, that is one of the most important next steps.
Thank you very much, Aisha, Janna, and Katrina, for such a wonderful conversation. I'm sure that our audience will love to listen to these insights on why this study is so important. Thanks for joining us for this insightful conversation. Please check the show notes for a link to the SRHM Journal, which is available online and open access. Follow us on social media and sign up for our newsletter to receive notifications for new publications. If you're enjoying this podcast, please subscribe, give us a rating, or leave a review. Sharing evidence-based and rights-grounded knowledge is our passion, and it's also critical to support the advocacy and actions that need to be taken to improve SRHR for all. We would very much appreciate it. Thank you for supporting the SRHM podcast, which is produced by our staff. The music was composed by Tiber Christian and Salomon Beautond.